Welcome to Wellness in EMS. What is wellness? Wellness is a state of health and happiness, well-being, that involves lifestyle choices in pursuit of an optimal state of health. Different components we're going to discuss include physical well-being and mental well-being. Physical well-being includes taking care of your body, trying to be physically fit, maintaining adequate nutrition and proper body fat, obtaining adequate rest, and preventing disease and injury. As you can imagine, this can be quite difficult in EMS. As far as maintaining adequate nutrition and proper body fat, EMS is always eating on the run. We eat a lot of fast food, and that makes it quite difficult to maintain a good nutrition. You're always eating quickly and in fear of getting a run in the middle of your meal. Back to obtaining adequate rest. Obtaining adequate rest can be quite difficult because, as you can imagine, it's quite difficult to sleep knowing that you might have to wake up and respond to a life-threatening emergency. And preventing disease and injury. This plays into physical well-being in a variety of means. You're going to utilize PPE, as we've discussed this before, as well as being physically fit. This comes into play here. As if you're able to keep yourself physically fit, then you are less likely to incur back injuries or other type of on-the-job injuries. Mental well-being. Still on physical well-being. Regular exercise. This falls under the. Go back there. Yeah, this falls under physical fitness. Utilizing regular exercise to stay in shape, and round is not a shape. Stress. Stress is a chemical, physical, or emotional factor that causes bodily or mental tension. As you can imagine, stress can be extremely hard on the body. People who are stressed, they tend to have higher heart rates, higher blood pressures, which causes physical harm on the body. And this physical harm can cause a variety of issues, including decreasing your immune system, putting an unnecessary amount of workload on your heart, and as well as other problems. Some benefits of physical fitness include improved personal appearance and self-image. This works for both you and the physical appearance that the citizens you're serving portray. They would much rather see somebody who is physically fit and appears that they are capable of doing the job. This decreases resting heart rate and blood pressure, which decreases the overall workload on the heart, increases the oxygen carrying capacity, and increases muscle mass and metabolism. Good dietary habits include the following: limiting fat, saturated fat, and cholesterol intake, reducing or avoiding the intake of sugar, caffeine, and alcohol, eating a variety of foods each day, and limiting salt intake. Both shift work and long work hours have been associated with health and safety risks. Obtaining adequate rest is necessary to restore energy, maintain a healthy immune system, handle stress, and function at your best. And as we discussed, this can be quite difficult beyond the fact of long hours and difficult work, but the attempting to sleep while you're working a 24 or 48-hour shift can be difficult because it's difficult to sleep while you may have to go out, while you may have to wake up and move quickly. Mental well-being. The ill or injured patient, family, and friends expect excellent medical care. They'll also depend on you for emotional support, especially the family. They're going to be looking to you, asking you lots of questions, and this can be quite daunting on your mental well-being. Different emotions. You may experience joy, pride, contentment, or you may experience anger, anxiety, frustration, fear, grief, feelings of helplessness, unable to relieve suffering. Patient dies despite your best efforts to resuscitate him or her. Let's go back to some of the positive emotions. You may experience these for doing a good job, being able to take care of your patient well, being able to perform your duties adequately or above average. However, you may experience the other side, the anger and all these other feelings, if you're unable to perform your duty, or if you did the best you could and you were still unable to help your patient. Ultimately, we get into this career to help our patients, to take care of people. And when you put every effort possible and do everything within your power to take care of them and it doesn't work, this can be difficult to deal with. You learn to recognize and control these feelings while caring for patients. It's important. You need to be in control physically and mentally on scene. Patients and patients' family will be looking to you, and you need to maintain a working attitude. Your patients and patients' family need to see you as in control and professional. You must act professionally, be able to work quickly, think clearly, and make appropriate decisions regarding your patient's care. And you're going to need to be able to do this in a variety of difficult situations. You must learn to anticipate and recognize signs and symptoms of stress in yourself and others, and manage signs and symptoms of stress when they occur. We've talked about different signs and symptoms in the past in other lectures. Different things can include anger, change in dietary habits, increased alcohol consumption, illicit drug use, illegal or illicit drug use, and a variety of other things. And means of controlling these are talking to your partner, talking to a friend, seeking out some of the programs that may be available. We've said that some larger ambulance companies have counseling programs available for providers as well as their family members. And especially on large incidents or incidents that may be difficult to deal with, such as a pediatric death, critical pediatric patient, death of a coworker, death of a family member on scene. These things may end up going towards what we talked about, the critical incident stress debriefing, or you may need to utilize critical incident stress management. And those, again, are two terms you need to be familiar with, CISD and CISM. Well, that is it for this lecture. This lecture is a fairly short one. Thank you very much.